Are they a little puffy? Maybe they look like they've been stuffed into your shoes by the end of the day. Maybe your socks leave a ring around your leg when you take them off at night. If you're nodding your head right now, I want you to stay with me. Because what most doctors aren't telling their patients over 60 is that those swollen ankles are probably not coming from your heart at all. In fact, rushing to blame your heart and the medications that come with that could actually be making the real problem worse. Today, I'm going to show you exactly what is really causing that swelling, why it almost always starts after age 60, and the simple 5-minute daily habit that can drain those ankles without a single pill. Welcome back. If you're new here, this channel is dedicated to real, practical health information for people over 60. No fear-mongering, no confusing medical jargon, just straight answers to the health questions that matter most in your golden years. Now, I want to ask you something. How many of you have gone to the doctor about puffy ankles or swollen feet and been told something like, "It could be your heart, let's run some tests"? Or worse, been handed a prescription for a water pill and sent home? Millions of seniors go through this every single year. And while yes, in some cases, swollen ankles can signal a heart or kidney issue, the truth is that for the vast majority of people over 60, the number one cause of ankle swelling is something completely different. It's your lymphatic system. And I'm willing to bet almost no doctor has ever sat down and explained that to you. So today, that changes. We're going to talk about what the lymphatic system is, why it starts to slow down after 60, what happens when it gets sluggish, and most importantly, what you can do about it starting today in just 5 minutes a day right in your own home. Let's get into it. Let's start with the basics, because most people have heard of the lymphatic system but have no real idea what it actually does. Here's a simple way to think about it. Picture your body as a busy city. Blood vessels are like the highways. They carry oxygen, nutrients, and everything your cells need to survive. But as all that traffic flows through, it creates waste. Fluid leaks out of the blood vessels, carrying with it dead cells, toxins, bacteria, and cellular debris. Now, somebody has to clean all of that up. That's the lymphatic system. It's a network of tiny channels, kind of like drainage pipes, that runs throughout your entire body. Its job is to collect all that excess fluid and waste, filter it through small stations called lymph nodes, and return it to the bloodstream to be flushed out. Now here is the critical thing to understand, and this is something most people simply don't know. Your heart pumps blood, but nothing pumps lymph. That's right. Unlike your circulatory system, which has the powerful heart muscle pushing everything along, your lymphatic system has no pump at all. It relies entirely on you, on your muscle contractions, your breathing, your movement, to push fluid through. When you walk, when you breathe deeply, when you stretch, those physical movements squeeze the lymph vessels and keep the fluid moving. But what happens when you slow down? What happens when, like many people over 60, you're sitting more, moving less, maybe dealing with arthritis or joint pain that makes exercise harder? The lymph fluid begins to pool. And guess where it collects first? Exactly, your ankles and feet, the lowest points in your body, where gravity pulls everything down. That puffiness you see and feel, in most cases, that is stagnant lymph fluid. Not a failing heart, not kidney disease, just a sluggish lymphatic system that needs a little help moving. Now you might be wondering, if the lymphatic system has always relied on movement, why does this seem to get so much worse after 60? Great question. And the answer involves several things happening in your body at the same time. First, your muscle mass naturally decreases with age. This process starts as early as your 30s, but it really accelerates after 60. Since your lymph vessels rely on surrounding muscle contractions to move fluid, less muscle means less natural pumping action throughout the day. Second, your blood vessels become less flexible. As we age, the walls of our veins and lymph vessels lose some of their elasticity. They don't expand and contract as efficiently, which means fluid leaks into the surrounding tissue more easily and gets moved back more slowly. Third, most people over 60 simply sit more. Whether it's because of retirement, joint pain, fatigue, or just a slower daily routine, the average amount of physical movement drops significantly after 60. And since movement is the engine of your lymphatic system, less movement means slower drainage. Fourth, gravity is relentless. The older we get, the more time many of us spend sitting in chairs, recliners, or watching television with our feet flat on the floor. Hours of that, day after day, and the fluid in your lower legs and ankles has nowhere to go. And here's something that will surprise many of you. Certain medications, commonly prescribed to seniors, can actually worsen lymphatic swelling. Medications for blood pressure, diabetes, and pain, including some calcium channel blockers, steroids, and even certain over-the-counter anti-inflammatories, can cause or worsen fluid retention in the lower extremities. So if your doctor prescribed something new and your ankles got puffier shortly after, that connection is absolutely worth mentioning at your next appointment. Now, I want to pause here for just a moment. If you are over 60, or if you are caring for an elderly loved one, the information I am about to share with you could genuinely be life-changing. For some people, even life-saving. Because when we understand the real cause of a problem, we can finally start solving it correctly. And the solutions I'm going to share don't require medication, expensive equipment, or a trip to a specialist. Before we get to the 5-minute habit, I want to make sure we cover your safety. Because while lymphatic swelling is the most common cause of ankle puffiness in seniors, there are situations where swelling signals something more urgent, and I would never want you to miss one of those signs. Here's how you can tell the difference. Signs that your swelling is likely lymphatic and not a medical emergency. The swelling comes and goes. It's worse in the evening and better in the morning after your legs have been elevated during sleep. Both ankles tend to swell equally. The skin feels soft, maybe slightly shiny, but it is not hot or red. You have no chest pain or difficulty breathing, and when you elevate your feet, the puffiness goes down within an hour or two. Sound familiar? For most people watching this, that is exactly what they're experiencing. Now, here are the warning signs that mean you should call your doctor right away. Swelling that comes on suddenly in just one leg, especially with pain, warmth, or redness. This could be a blood clot, and it needs immediate attention. Swelling that comes with shortness of breath, especially when lying down. Swelling with chest pain or pressure of any kind. Swelling in your face, your hands, or your abdomen, not just your feet. Swelling that is extremely painful, or where the skin feels tight, hot, and hard to the touch, and significant pitting, meaning you press your finger into your ankle, release it, and the indent stays there for more than 30 seconds. If any of those apply to you, please reach out to your doctor before trying any home techniques. But if your swelling is the gradual, everyday, end-of-the-day kind, the kind that's been there for months or years, and your doctor has already said your heart looks fine, then what comes next is going to be very helpful for you. All right, here it is. The 5-minute daily lymph drainage routine. This is based on a technique called Manual Lymphatic Drainage, used by physical therapists and certified lymphedema specialists around the world. We've simplified it into something you can do yourself, every day, right in your own chair or on your bed. A few key things to keep in mind before we start. Use very light pressure. You are moving fluid just beneath the skin, not massaging deep muscle tissue. Think of it as the weight of a feather, not a firm squeeze. Always move fluid upward, toward your heart. Work from the upper part of the leg, first to clear the path, then move down to the ankle. And breathe deeply throughout the entire routine. Deep breathing is one of the most powerful natural pumps your lymphatic system has. Ready? Let's go through it step by step. Step 1. Diaphragmatic breathing. This takes about 60 seconds. Sit comfortably in a chair or lie on your bed. Place both hands on your belly, just below your ribs. Breathe in slowly through your nose for a count of 4, letting your belly rise, not your chest. Hold for 2 counts, then exhale slowly through your mouth for a count of 6. Do this 10 times. This is not just relaxation. Deep belly breathing creates a pressure change in your chest and abdomen that physically moves lymph fluid upward through the large vessels near your collarbone. Think of it as turning on the suction at the top of the drain before you send anything up. Every single session should start here. Step 2. Clearing the groin nodes, about 60 seconds. Your groin, right where your thigh meets your pelvis, contains a cluster of lymph nodes called the inguinal nodes. These are the main drainage stations for your entire lower body. Before you do anything with your ankles, you need to clear space at these nodes first. Otherwise, you're pushing fluid toward a traffic jam that has nowhere to go. Place your palms flat on your inner upper thighs. Using extremely light pressure, no more than the weight of a coin, slowly stroke upward toward the groin, then release. Think of it as gently sweeping. Do this 10 slow strokes on each leg. Step 3. Clearing behind the knee, about 45 seconds. The back of the knee contains another cluster of nodes called the popliteal nodes. These collect fluid from the lower leg and pass it upward. Bend your knee slightly. Using your fingertips, make very gentle circular motions in the crease behind your knee. Soft, barely there pressure, moving in slow circles for about 15 seconds per leg. You are not rubbing the muscle. You are gently stimulating the lymph vessels just under the skin. Step 4. The ankle drainage stroke, about 90 seconds. Now we reach the ankles. But remember, we always work upward. Sit with your foot flat on the floor or slightly elevated. Place both hands around your lower calf, just above the ankle. Using light, gentle pressure, stroke slowly upward from the ankle toward the knee, as if you are coaxing fluid upward. Don't press hard. Don't rub back and forth. One slow, gentle upward sweep, then reset and repeat. Do 10 strokes per leg. Then, using 2 or 3 fingertips, make small, gentle circles around the ankle bone on either side, moving in the direction of your calf toward the knee. This directly stimulates the lymph vessels in the ankle area that are responsible for draining the swelling you see and feel every day. Step 5. Elevation and final breath, about 45 seconds. End every session by elevating your feet. A footstool, a few stacked pillows, or the end of your bed all work perfectly. Try to get your feet above the level of your heart if you can. Take 5 more slow, deep belly breaths, just like you did at the beginning. The combination of drainage and elevation gives the fluid the best possible chance of being absorbed and transported out of the area. And that is your 5-minute routine, done. Will you feel a dramatic difference after the very first session? Perhaps. Some people notice their ankles feel noticeably lighter within 30 to 60 minutes, but for most people, the real and lasting results come with consistency. Do this every single day, ideally in the evening before bed or in the morning before you start your day, and within 2 to 3 weeks, most people notice a significant reduction in their baseline swelling. Some people find that their morning ankles look almost completely normal when before they never did. Now, the 5-minute routine is your foundation, but there are several supporting habits that will amplify your results even further. Walking, even a little, goes a long way. Even a 10-minute walk helps enormously. Each step contracts the calf muscles, which squeeze the lymph vessels in your legs and push fluid upward. If joint pain limits your walking, seated leg lifts or calf raises while sitting in a chair still make a real difference. Elevate your legs whenever you can. When you sit to watch television or read, put your feet up. A simple footstool is one of the most underrated tools for lymphatic health. The goal is to get your feet above the level of your hips so that gravity works with you instead of against you. Stay well hydrated. This surprises many people. They assume drinking less water will reduce swelling, but the opposite is true. When you're dehydrated, your body holds onto fluid even more tightly. Drinking 6 to 8 glasses of water a day actually helps the lymphatic system move more efficiently. Reduce your sodium. Salt causes your body to retain water. If your ankles swell more after a salty meal, you already know this firsthand. Cutting back on processed foods, canned soups, and restaurant meals, which tend to be very high in sodium, can make a noticeable difference within days. Wear compression socks the right way. Compression socks or stockings usually in the 15 to 20 millimeter of mercury range for mild swelling, provide gentle external pressure that supports the lymph vessels in your legs. The critical thing is to put them on first thing in the morning, before swelling has a chance to build. They are much more effective as prevention than as treatment after the legs are already puffy. And take movement breaks. If you sit for long periods, on car trips, airplane flights, or simply during a long afternoon at home, try to get up and walk for 2 or 3 minutes every hour. If you can't get up, ankle circles and calf raises in your seat help keep things moving. Quick question for you. Has your doctor ever explained to you that your swollen ankles might be a lymph issue and not a heart issue? Leave a comment below right now. Just write, "Yes, they told me," or "No, nobody ever mentioned this." I read every single comment, and I genuinely want to know how many of you have been dealing with this for years without ever getting the real explanation. And if you know someone, a parent, a sibling, a neighbor, a friend over 60, who wakes up every morning to puffy ankles and thinks it's just part of getting older, please share this video with them. It takes 2 seconds, and it could genuinely change how they feel every single day. One final point before we close. If you have had swelling for a long time, if the skin on your lower legs has started to change in texture, becoming thickened, darker, or leathery, or if the swelling simply does not respond to the techniques and lifestyle changes we've discussed, it is worth asking your doctor for a referral to a certified lymphedema therapist. These are specially trained physical or occupational therapists who can provide professional lymphatic drainage, fit you for proper medical-grade compression garments, and create a personalized care plan for more advanced lymphatic issues. This is a real, medically recognized service, and in many cases, it is covered by insurance. You deserve to know it exists. Let's bring everything together. Swollen ankles after 60 are incredibly common, but they are not something you simply have to accept as a normal part of aging, and in most cases, they are not a sign that your heart is failing. The most overlooked and under-discussed cause is a sluggish lymphatic system, a network that depends on your movement, your breathing, and your daily habits to keep fluid flowing properly. The good news is that you have real power over this. With just 5 minutes of gentle self-drainage each day, combined with daily walking, proper hydration, leg elevation, and a little less salt, most people over 60 can dramatically reduce their ankle swelling, naturally, safely, without adding another medication to the list. Your body is remarkable. Even after 60, even after decades of wear and change, it responds beautifully to the right kind of care. You deserve to feel comfortable in your own body. You deserve to put your shoes on without wincing. You deserve to feel light on your feet again. And the beautiful thing is, it can start today, right now, with 5 minutes. If this video was helpful to you, I have 3 small requests before you go. First, hit that subscribe button and ring the notification bell. Every week, I share real, practical health information made specifically for people over 60. No fluff, no scare tactics, just useful, trustworthy content that respects your time and your intelligence. Second, share this video. Think about the people in your life who deal with this every day and have no idea why. Send it to them. It costs you nothing, and it could improve their quality of life in a real way. And third, leave me a comment. Did you try the 5-minute routine? Did your ankles feel different afterward? Have you been dealing with this for a long time and nobody ever connected it to your lymphatic system? Tell me your story. I read every comment, and your experiences help me understand exactly what to cover next. Thank you for being here. Take care of yourself. Take care of the people you love, and I will see you in the next video.